Low back pain and sciatica is one of the most common things that we treat in the clinic. Today we're going to talk specifically about sciatica due to lumbar stenosis. So there are two types of stenosis. You have central and lateral stenosis. The word stenosis means there is a narrowing of the spine. If you look at the back of the spine, you can see that the nerves come out the left and right side of each segment. When you have central stenosis, the spaces on the back of your spine are getting compressed and can actually pinch the spinal cord. This is very dangerous as it can cause a loss of bodily functions like defecating or urinating. You can also have leg weakness where you can't stand or walk. If you're experiencing a loss of bodily functions like defecating or urinating, it's a medical emergency. The reason why it's a medical emergency is because when the spinal cord is getting compressed, it can actually lead to permanent damage. With lateral stenosis, it is less severe and not a medical emergency, and you might feel symptoms on only one side of the leg. With lateral stenosis, you'll have narrowing of the spine on one side, where you will not lose bodily functions. However, you should still seek medical attention. Now let's talk about the common causes of lumbar stenosis. One of them is osteoarthritis, which is inflammation of the joints and the discs along the spine. When the joints get inflamed, it can cause irritation on the nerves and flare up the symptoms that's shooting down the back of your legs. Another condition that causes stenosis is spondylolisthesis. This is a condition where the disc shifts forward, pressing on the actual nerve. Muscle imbalances in the low back and core can also cause lumbar stenosis. You have muscles of the low back that run up the spine and the core muscles that wrap around the torso. The back muscles and abdominal muscles are constantly playing tug of war. When the back muscles are too tight and dominant, the abdominal muscles are lengthened and become weak. This causes extra compression forces on the low back area. Now that you know what lumbar stenosis is and what causes it, let's get into my favorite mobility and strengthening exercises. The first exercise that we're going to get into is called a child pose, also known as a prayer stretch. This is a great exercise to open up the back and decompress the nerves. You want to start off on your hands and knees, known as a quadruped position. First, you're going to breathe in, and then as you exhale, you're going to sit your butt into your heels. You should feel a stretch in your arms as well as your low back. Hang out there for 20 seconds for 3 rounds as you breathe in and out nice and easy. The second exercise is a posterior pelvic tilt. We're going to start off in a hook line position on your back with both knees bent. I want you to imagine there's a clock on the right side of your hip. You're going to rotate the pelvis in a counterclockwise motion until your low back is flat on the bed or the floor. If you do this correctly, you should feel the lower abdominal muscles underneath the belly button. Once you feel the lower abdominal muscles work, I want you to squeeze your butt cheeks and hold that for 15 seconds for 4 rounds. The third exercise is a posterior pelvic tilt with knee to chest stretch. You lie in a hook line position and perform a posterior pelvic tilt and pull one knee towards your chest. Low back should be flat on the bed or the floor while you squeeze the opposite butt cheek. Hold this for 20 seconds for 3 rounds. The progression for this would be the double knee to chest with the posterior pelvic tilt. For those of you who don't feel a stretch, you can also put a yoga mat under your tailbone while pulling both knees toward your chest. Hold this position for 20 seconds and 3 rounds. The fourth exercise is a posterior pelvic tilt with crunch hold. You lie in a hook line position, perform a posterior pelvic tilt until you feel your lower abdominal muscles engage. Then what you're going to do is perform a chin tuck and then point 2 fingers towards your knees, contract your upper abdominals and reach towards your knees. Your low back should be flat on the bed or floor the whole time. Once you feel your upper and lower abdominals and your low back is flat on the bed or floor, hold this position for 15 seconds for 4 rounds. The fifth exercise is a cat from the cat-cow pose. So you start in a quadruped position, and what you're going to do is breathe in while you feel the air in your mid-back area. As you exhale, you're going to perform a posterior pelvic tilt until you feel your abdominal muscles engage. Repeat for 5 breaths, where every time you exhale, you try to posterior pelvic tilt more and get more butt and abdominal engagement. Ideally, you want to rotate these exercises every hour to not just stretch the back, but make them stronger. Now that you know how to manage sciatica with lumbar stenosis, comment below and let me know which of these exercises work best for you. Also, if you found these videos helpful, please consider subscribing. As always, move better, age stronger, and I'll see you next time.